Did you know there's a hidden nutrients deficiencies that silently contributes to millions of diabetes cases worldwide? Yes, you heard that right. A deficiency so overlooked that it keeps people from managing their blood sugar effectively or even putting them at risk in the first place. If you're living with diabetes or worried about developing it, this is something you absolutely can't ignore. Diabetes is one of the major causes of blindness, neuropathy, kidney disease, and heart issues. But what if improving some key aspects of your nutrition could make a real difference? In today's video, we're going to uncover these nutrients, explain why they're so critical, and most importantly, show you how to spot and address their deficiencies. Number 1. Magnesium. You might ask, what links magnesium and diabetes? According to studies, nearly 70% of people with diabetes have insufficient magnesium levels. This is a startling figure, given its importance in managing blood sugar and preventing complications like neuropathy, heart disease, blindness, and kidney issues. Magnesium is one of the most critical nutrients for overall health. It's essential for over 300 biochemical reactions in the body, many of which are directly related to blood sugar regulation. When you eat carbs, your pancreas releases insulin, which helps cells absorb glucose from the bloodstream. However, when your magnesium level is low, the insulin becomes less effective, a condition known as insulin resistance. And over time, this can lead to elevated blood sugar levels and, eventually, type 2 diabetes. People with diabetes frequently experience increased urination. This is because high glucose levels cause the kidneys to excrete more magnesium, creating a vicious cycle of deficiency and worsening blood sugar control. Magnesium deficiency in a body causes abnormal eye movements, convulsions, fatigue, cramps, muscle weakness, and numbness. The good news is that magnesium deficiency is manageable through diet and supplementation. Dietary sources of magnesium include green leafy vegetables, whole grains, legumes, nuts, and seeds. On the other hand, the best magnesium supplement is magnesium glycinate, which is highly bioavailable and gentle on the stomach. It not only replenishes magnesium levels, but also promotes relaxation and better sleep when taken at night. Prioritizing magnesium through diet, supplements, or both can help your body regain its natural ability to maintain balanced blood sugar levels. 2. Vitamin B12. What is the connection between B12 and diabetes? Vitamin B12, also known as cobalamin, plays a vital role in nerve health, DNA synthesis, and red blood cell production. For diabetics, the risk of B12 deficiency is particularly high, especially those on metformin, a frontline medication for managing type 2 diabetes. Research shows that metformin interferes with the absorption of B12 in the gut by altering the gut microbiota and damaging the cells responsible for absorbing this vitamin. Over time, this can lead to a significant depletion of B12 stores in the body. Studies have revealed a strong connection between B12 deficiency and the complications of diabetes. For instance, B12 deficiency exacerbates diabetic neuropathy by causing damage to the protective sheath around nerves. This can lead to increased pain, tingling, and loss of sensation in extremities. B12 plays a role in cellular energy production. Its deficiency impairs glucose metabolism, making blood sugar regulation even more challenging. Low B12 levels can lead to increased levels of homocysteine, an amino acid linked to cardiovascular risks, a serious concern for diabetics. B12 deficiency also causes body weakness, vomiting, yellowish skin, and weight loss. To combat B12 deficiency and its impacts, do routine blood tests to check B12 levels, especially if you're on metformin or experiencing symptoms of its deficiency. Incorporate B12-rich foods like meat, fish, eggs, and dairy. Vegetarians and vegans should consider fortified foods. If dietary intake isn't sufficient, healthcare providers may recommend B12 supplements or injections for faster replenishment. This nutrient might seem small, but its role in keeping your nerves healthy and your blood sugar stable is monumental. Don't let a silent deficiency derail your health. Take control today. Don't forget to like and subscribe to support our channel. 3. Omega-3 fatty acids. Why omega-3 deficiency leads to diabetes? Research shows that omega-3 fatty acids are vital for reducing inflammation, improving insulin sensitivity, and supporting heart health, 3 critical factors in diabetes management. High blood sugar levels are associated with chronic inflammation, which can worsen insulin resistance, a hallmark of type 2 diabetes. Omega-3s have potent anti-inflammatory properties that help counteract this process. The pancreas, which produces insulin, relies on proper lipid metabolism to function effectively. Omega-3s, as healthy fats, contribute to maintaining the structure and function of pancreatic beta cells. A deficiency in omega-3s can lead to beta cell dysfunction, impairing insulin production and increasing the risk of diabetes onset. Omega-3 deficiency also causes skin irritation and dryness, depression, dry eyes, and joint pain. The good thing is that you can boost omega-3 levels by including omega-3 rich foods such as fatty fish like salmon, mackerel, and sardines, or through plant-based sources such as flax seeds, chia seeds, and walnuts, or fortified foods like some brands of eggs and milk, or consider fish oil or algae-based omega-3 supplements for vegetarians and vegans. Always consult your healthcare provider before using supplements to avoid potential effect. Making omega-3s among priorities in your nutrition plan is a significant step toward better diabetes management and prevention. 4. Vitamin D. How and why vitamin D deficiency can lead to diabetes. Vitamin D is involved in the function of pancreatic beta cells, which are responsible for producing insulin. Insufficient levels of vitamin D makes it harder for the body to utilize insulin properly, leading to insulin resistance, a hallmark of type 2 diabetes. Moreover, chronic inflammation is a known contributor to both insulin resistance and diabetes-related complications. Vitamin D has anti-inflammatory properties, and its deficiency can exacerbate inflammation, further increasing the risk of developing or worsening diabetes. Vitamin D is also crucial for a balanced immune response. Type 1 diabetes, an autoimmune condition, occurs when the immune system attacks insulin-producing beta cells. Therefore, adequate levels of vitamin D might help lower the risk of such autoimmune attacks. Deficiency in vitamin D further causes muscle pain, bone pain, and increased sensitivity to pain. To address vitamin D deficiency, safe exposure to sunlight is the most natural and effective way. Or, incorporating vitamin D-rich foods such as fatty fish, egg yolks, fortified dairy products, and cereals in your diet. Vitamin D3 supplements are often recommended by healthcare providers. In regions with limited sun exposure, as dietary intake alone may not be sufficient. Vitamin D is more than just the sunshine vitamin. It plays a critical role in glucose metabolism, insulin function, and inflammation regulation. Its deficiency is a hidden but significant risk factor for diabetes. 5. Zinc. How is zinc associated with diabetes? Zinc is essential for the synthesis, storage, and secretion of insulin, the hormone responsible for regulating blood sugar levels. It helps stabilize insulin molecules and protects them from degradation, ensuring they function properly. Research shows that zinc deficiency can impair insulin production, making it harder for the body to maintain stable blood sugar levels. Chronic inflammation and oxidative stress are major contributors to the complications of diabetes, such as neuropathy and cardiovascular disease. Zinc acts as a potent antioxidant, neutralizing free radicals and reducing inflammation in the body. People with diabetes are more prone to infections due to weakened immune systems. Zinc supports immune cell function and helps the body fight off infections, a vital benefit for diabetics. Deficiency in zinc compromises the immune system, making it harder for the body to heal wounds and fend off illnesses. Zinc deficiency also causes hair loss, skin changes, eye problems, and more infections than usual. Ensuring adequate zinc intake, through diet or supplements, is crucial for anyone with diabetes or at risk of developing it. Foods rich in zinc, like meat, shellfish, seeds, and legumes, can help, but for many, supplementation may be necessary. Addressing zinc deficiency could mean improved insulin function, better immune health, and reduced inflammation, key factors in living a healthier life. 6. Vitamin B1. Vitamin B1, also known as thiamine, plays a crucial role in energy metabolism and nerve function. It's vital for converting food into energy, helping the body produce adenosine triphosphate, which is the main source of energy for cells. Thiamine is also necessary for the proper function of the nervous system, muscles, and cardiovascular system, making it essential for overall health. However, research has shown that people with diabetes often have lower levels of thiamine in their bodies, and here's why. High blood sugar levels lead to an increased excretion of thiamine through urine. This means that even if a person is consuming enough thiamine, their body may be losing more of it than it should, leading to its deficiency. The mechanism behind this is thought to involve the kidneys, which work harder to filter excess glucose in the blood, inadvertently flushing out thiamine. Without enough thiamine, the body's ability to metabolize glucose efficiently is impaired. Moreover, thiamine deficiency causes loss of appetite, weakness, pain in the limbs, shortness of breath, and swollen feet. However, to boost thiamine levels, consume thiamine-rich foods like whole grains, legumes, nuts, seeds, and meats, especially pork. And if you're unable to get enough thiamine from food or if you have diabetes, supplements may be an option. However, it's important to consult your healthcare provider before starting supplementation, as they can guide you on the appropriate dosage and monitor for any adverse effects. Thiamine plays an essential role in glucose metabolism and nerve health. Therefore, consuming thiamine-rich foods or taking supplements under medical guidance can help protect your health and better manage your diabetes. If you found this video helpful, please like and subscribe. Thanks for watching.